There's some evidence that in general people with developmental disabilities have been disproportionately impacted by COVID. But it's probably a complicated story in the following way, that we know that for some conditions there are immune challenges associated with that condition. So that could predispose them to have more severe symptoms if they have the virus. But there's also evidence that some of it has to do with living situations, so that so many adults with intellectual and developmental disabilities may be in situations where they're living in homes and don't have access to care, to physicians, they can't get to a doctor or those sorts of things. Or they're in places where there are lots of people that tend to have, maybe they've been exposed to the virus, and so there's kind of almost like in where we had at the beginning, there were a lot of problems with facilities where there are elders, right? And so that they're for some adults with disabilities, they may be in kind of congregate settings where that kind of increased their risk. I think in other cases, we know that, for example, adults with intellectual and developmental disabilities, many of them live in poverty, so they don't have access to care and nutrition. And so I think there's probably a whole host of things that has led to them being more vulnerable, more likely to get COVID, more likely to die from COVID, more likely to be hospitalized, and those sorts of things. And so they've been disproportionately affected. And again, probably for a variety of reasons having to do with either physical health or living circumstances, or just the consequences of them being more likely to live in poverty, which we know is correlated with a whole host of bad health outcomes. Well, I think the one thing that we have learned from the pandemic is that there's a lot more we can do through telehealth and technology than we thought. So that's a good thing. I think the other thing that we've learned is in this country, so much of our systems of support for families of children that have developmental disabilities depend on someone being there with them, and that was not available during this pandemic, right? And so I think what I hope we've learned is that we need to think creatively of how to create really robust systems of intervention, robust systems of support that can withstand these kinds of challenges. And I think technology is one of the things that can be the backbone of a more robust system of care for families. It's not the answer for everything. Sometimes you need to be in the room with somebody, but I think that that's often hard, and I think we should look at technology as a way of really being innovative in creating systems of support. We have colleagues here, for example, at the Mind Institute, who are using virtual reality to help train kind of better attentional skills in children that have attentional problems. We could use technology. In fact, I have a colleague at Michigan State who's using virtual reality to do job training for adults with intellectual disabilities. And so I think if we're creative, we can use technology to really complement what we do face-to-face, and that reduces sometimes costs, reduces burden on families for travel if they don't live near a Mind Institute or another center of excellence. And so I think that I hope we take away some really important lessons from the pandemic. I also think we need to make sure that we test these things to see if it works through telehealth or it works through technology, so we have good evidence. We don't want to just assume it will work, but I think the pandemic, I hope, will change how we think about provision of care going forward.